Okay, well, it's 9:01 Eastern Time here in North America. So I think we can get started with today's webinar. Hello and welcome to day 3 of World Burn Week. Today's theme is common responsibilities. I'll just ask Natalie to bring up a slide about translation for today's webinar. As you can see, there's a button you can click called Translation. When you click that, you'll be given some options to choose the language you'd like to translate into. So if people would like to go ahead and use the translation button if needed. Okay, Natalie, I think we can move on. Okay, well, good morning here in North America. My name's Rob Cartotto. I'm hosting today's webinar. I'm a recently retired burn surgeon in Toronto, Canada, and I'm a past president of the American Burn Association. It's an absolute pleasure to host today's webinar on behalf of the American Burn Association and also the Phoenix Society for Burn Survivors. Today's webinar is intended to raise awareness on some topics that are common around the world to burn patients, our burn survivors, and of course, our burn care providers. That issue around the world is really the declining number of burn care providers. We've seen post-pandemic burnout, we've seen a loss of engagement, and also importantly, an aging workforce. And all of this has contributed to this potential problem and existing problem of a shortage of burn care providers. And this affects, of course, our burn patients and our burn survivors. And so we've chosen this theme today for that very important reason. The way we thought we'd approach this is, first of all, to hear from a burn survivor. And we want to hear their perspective on the importance of the burn care provider to what they went through and the journey that they are still on. And their stories, I think, as many people know, are inspiring and they're motivating. And they will, I think, be of a help to everybody who's listening. We're also going to speak with some burn care providers around the world to ask how they maintain an engaged and active burn care provider workforce. And then finally, at the end, we're going to spend a few minutes to talk about worldwide burn prevention efforts. And we'll hear from 2 experts in the field toward the end of today's webinar. So to begin, I'd like to start by introducing our first panelist. This is Gina Russo. Gina is a 21-year survivor from the station nightclub fire that claimed over 100 lives and injured about 200 people. She has gone on to thrive and live a full and very productive life. She's been raising her family. She's been a very important peer supporter for the burn community, and this has become her life's purpose. Gina, welcome to today's webinar.
Thank you.
I wonder if you could start by sharing your story and journey with the audience for a few minutes.
Okay, sure. So those not familiar with the station nightclub fire that happened on February 20th, 2003, it was caused by a rock band setting off pyrotechnics in a very small nightclub. And we lost 100 people, 99 people died immediately. The 100th patient died in May of 2003. I sustained over 40% burn injury and it was 3rd and 4th degree from my head to my shoulders and back.
Thank you. So Gina, my first question, and this is a bit strange because we usually talk about burn care providers helping to support burn patients and burn survivors, but I'm going to turn the question around.
Okay.
And it's 2 parts. The first thing I want to ask you about is what is your view on the role of burn survivors and the importance they are to providers? And tied to that is how burn survivors can help support the providers.
Obviously, the providers are essential. I certainly wouldn't be alive without the doctors who took their time to take care of me. It's vital that they're there. I think I provide back to them the knowledge that I've attained in the last 21 years of what it's like to be a survivor, the different things that our bodies go through after going home and surviving something that most people don't. I feel like the caretakers and the doctors are vital in our future, and the technologies that have come along in 21 years are amazing.
I wonder if I could ask you a little bit about an important period when you recall leaving the burn center and going back home, and that's a difficult transition period. Can you tell me a little bit about what that was like?
Sure. So the day on my discharge, I remember saying to one of my doctors, am I going to die of lung cancer because my lungs were so badly affected by the fire? And he said to me, just go out and live your life. So I left there very afraid. Not only that, I was going home to my
Mhm.
family's home that I hadn't lived in many years. I had been out on my own for a long time. I couldn't do anything for myself. I had to rely on my parents, my family, until healthcare workers showed up. I can tell you that first day in the house, I remember begging my mom and dad to take me back to the hospital. It was just a safe place. It really was.
That's a common thing that we hear from burn survivors, and it's
Yeah.
ironic they want to go back to the hospital. Um, I'm wondering, really, if you have any special stories during that period that you could relate. You mentioned the doctor who told you not to live your life in a full way. Are there any others?
So one of the things that I experienced while I was inpatient, the nurse was changing my head dressings, and she's trying to, I guess, distract me. So she's talking me through it, and as she uncovered my head, she said to me, "Don't worry, they can rebuild your ear." And I'm like, "What are you talking about? I can hear you." And she looked at me and she said, "Oh my goodness, they didn't tell you that you lost your outer ear." And I remember saying no. I started to cry. And then I'm thinking, what else did I lose that no one's told me about yet? So, very immediately, they had a psychiatrist come in and a couple of other burn care professionals. And we really, from head to toe, went over everything. So, it was that moment that they realized, oh, she sees herself as this person who's in a bed, but we need to get her up to date on what is actually happening. So I definitely appreciated that. That's for sure.
How important is giving a burn survivor or burn patient hope?
Incredibly important. Honestly, from the minute whether we're in a medically induced coma, whatever's happening, we truly believe life is over. We are never going to function again. If we have families, raise that family, go back to work. It is absolutely vital that patients know that life can be okay. And it does start with the provider, and then it goes on to the peer supporters that are available through the Phoenix Society. I know my life probably wouldn't be what it is without that.
You're 21 years out from your injury. Does that need for hope change?
It definitely does. My hope now, after 21 years, is to make sure that I can give new burn survivors the same care that I was given, the same support that I was given, so that they know they're not alone. Because every burn survivor believes they're the only one in the world. There's no one else exists. So that's kind of what I've been doing for the last 21 years, making sure that I'm available to new burn survivors and making sure they're called a survivor, not a victim.
Mm.
I don't like the word victim.
What are some of the most difficult things you've encountered when you help new burn survivors?
It's really the look on their face, like they probably want to tell me I'm crazy, that there's no way they're going to live a good life. And it's the fear. They have just so much fear in them that they're never going to be productive members of society again.
Do you remember anybody that was a burn survivor that offered you help early on? What do you recall?
Absolutely. Absolutely. These two women came into my room. I was a hot mess. And they really told me that life was going to be okay. And I remember thinking, you're crazy. But just before my discharge from the rehabilitation hospital, they came back to see me again. And my head was just a little bit clearer. And I was more open to their advice or to listening to them about peer support and what life could potentially turn out to be like. Many years later, I came in contact with one of my first peer supporters, and we had a good cry, and I told her my life was good, and really it started from there, meeting that other survivor.
Sounds like it's really about timing, isn't it?
Absolutely. It is.
One last question before we go to our next guest. Any words of advice about things burn providers maybe shouldn't do? Um, things we shouldn't say. I know that's a big question, but
um I can't say that I came across anything. I feel like my burns providers were incredibly honest with me. Um, they were encouraging. They just really just kept saying, "Go out and live your life, find your life." I think what they don't do enough of is the psychiatric piece of it. Everybody's so focused on taking care of us and getting us, the burns taken care of. The mental capacity of all of this is just as big. Um,
yeah.
Survivor's guilt. I mean, I was in such a large fire. The survivor's guilt was very, very real, and it took me a lot of years to come to
Mm.
terms with that. So I think that was probably a disservice, not having enough of that.
Mm. It just made me think of another question. You must stay in touch with a lot of survivors from the station fire then. Is that true?
Yes, it is.
Yeah.
Some have fared better than others. I
Mm.
feel like the ones with the actual burn injuries are doing much better than the ones that have just the psychological piece of it. Um, I encourage them all the time to talk about it, to not keep it hidden. And
Mm.
sometimes it helps, I think the more you talk about it and, show that it did happen, it kind of frees you from the guilt and the pain of it.
Okay. Well, thank you for sharing your thoughts and your story with us. We're going to come back to you toward the end because I'm going to ask you a little bit about prevention because I know you're passionately interested in
Mhm.
that too. But for the moment, I'd like to introduce our next three panelists. First is Jill Sproul. Jill's a former burn nurse that worked in clinical burn care for 28 years. She then served in hospital administration, and she's also a burn survivor. She was injured at the age of 7. She's very passionate about improving the lives of burn survivors, and she's been heavily involved with both the American Burn Association and the Phoenix Society for Burn Survivors over the past 3 decades. Our second guest is Alberta Amasa Rockson, and she's a deputy chief physiotherapist at Corley Boo Teaching Hospital in Ghana, Africa. She has 18 years of experience in burns. She is the rehabilitation lead for the Interburns UK charity. She also is co-chair for the WHO's World Rehabilitation Alliance Emergencies Committee. And last is Eunice Onuh, and she is a plastic and reconstructive surgeon in Nigeria, Africa. She has a passion for enhancing the outcomes of burn patients and burn survivors, and she's committed to delivering comprehensive care spanning the entire phase from the acute management to rehabilitation. So welcome to all of you this morning. Alberta, I'd like to start by asking you to please comment on the problem in your burn center in your country in maintaining an active and engaged workforce of burn care providers.
Thank you, Rob. Good morning, good afternoon, good evening to everyone on the call. Maintaining the workforce in Ghana, where I find myself working, specifically in a teaching hospital called Kolebu Teaching Hospital, is not an easy task. We have almost the full complement of the workforce, be it our consultants, those in training, the residents, nurses, either specialized or unspecialized in burn care, health workforce, be it physiotherapists, occupational therapists that we used to have until about 3 years ago, and all the other complements, be it the psychologist, even the medical laboratory scientist, and anesthetics. We have all these people. But the problem there is that when it comes to recruiting of these people to maintain the health force, it's not really just dependent on the center to want to recruit people. It's usually like more on the political front. So it's more dependent on vacancies and what we would call the financial clearance, allowing all these health groups to be able to be recruited into the hospital. The other area would look at the fact that we do not have burn specialists already in waiting, because we, being a teaching hospital, actually are the ones training. So we always have to, we mostly recruit people with no experience, and it depends on the center to give them that training and experience in burns care. So these are some of the things that gives a bit of a headache to the center when it comes to the workforce.
In one of our practice sessions, you were telling me a little bit about how many rehabilitation therapists you have and how many people they have to care for. Can you share that with the audience?
Well, for our center, we would say we have 2 permanent physiotherapists and 2 rotational physiotherapists for a bed capacity of about 24 burn patients and other reconstructive bed capacities, making a total of close to 80 beds in the center. For occupational therapists, for now, we cannot boast of any, because unfortunately, they have gone over for greener pastures. So for now, we do not have an occupational therapist, and we also do not have a speech and language therapist permanently assigned to our center, but the general hospital does have, and on an as and when basis, we call them in to support.
How long does it take to train a rehabilitation therapist?
In Ghana, the training is at a BSc level, and it takes a 4-year continuous education with a compulsory 1-year internship. So in total, 5 years.
I'm wondering, do you do any kind of outreach to try and attract potential rehab therapists to become burn specialized? What do you do, if anything?
Well, at the students level, it's more of the professional body having an engagement with them. And we happen to be close with what the professional body does in terms of trying to be like mentors for them. So within the clinical area whereby we support the school, we, the burn specialists, try our best to mentor these students and interns who rotate through the center, encouraging them to be part of us. And sometimes when there are trainings, we engage them in the training to see if they could have a little bit more interest in the area of burns.
Do you ever involve burn survivors in that outreach?
Sorry, could you come again?
Do you ever involve burn survivors as part of those outreach efforts? In other words, having burn survivors tell their stories to help motivate and engage potential providers.
The internet dropped a bit, but I think the question was about how we involve burn survivors.
Yes.
Thank you. So fortunately for us in our center, just barely 1.5 years ago, we got involved in having our own burn support group. And this, I believe, from the feedback of the survivors, it was quite a good initiative. And since then, we've been able to have a second one, and only coming Friday, we will be having our 3rd burn support group engagement. And we invited those who are back into community or have been re-engaged to be able to speak directly to the inpatients, to some of the inpatients, and to be able to have access to engage on a more friendly environment with all the healthcare professionals. And it was such a great learning opportunity because we realized that there were certain areas that we were not considering at all, especially when these patients were with us. And the engagement we had from the support group meeting has changed one or two ways of us doing things to help us to improve upon our services for them.
Could you tell us about some of those one or two ways? I'm interested to hear what those are.
So just like the other speaker said, I think engagement, especially with the psychology bit of care, hasn't been quite great. And with the engagement that we had with them, we realized that they needed more attention from us. And it wasn't just to have a psychologist engaging with them, but even the way our nurses, our therapists, our surgeons engage with the patients is of key interest to them. So this is one of the things that we realized that we can improve upon. And then they also had a concern because possibly in our system, we have a cash and carry system. They also raised concerns as to how certain consumables or utilities and everything they had to do, like their prescriptions, how we could help to support them. And it also drew more attention to us finding means to support these patients at the financial level, because the cash and carry system in Africa or in Ghana makes the financial burden on an individual patient a bit more stressful than we, the health workers, possibly think about. And that doesn't help them too well when on admission. So possibly these two engagements are the points I would say that we need to highlight on to improve upon our burn care services.
Okay. Tell me what you have seen or witnessed in terms of burnout and perhaps compassion fatigue among your colleagues, nurses, doctors, rehabilitation therapists. Have you observed this?
Please come again.
I'm asking if you have seen any burnout problems, loss of compassion among your colleagues.
Well, I haven't come across any research within the burn workforce, even though I know of other research within other health forces. But then physically, we can see a lot of burnout amongst we, the health workers, because I am inclusive. I do not exempt myself. Sometimes we go through the stress of helping patients through various means. We actually go looking for stakeholders to support them financially. We actually do like a internal fundraising, which our team lead nurse is very good at doing, encouraging all of us to give our widow's mite, especially with our pediatric children, to support them in the little way that we can do. So I think that gives and creates a lot of burnout, and we trying our best, because I mean, it's not easy just seeing a patient going down when there's actually nothing you can do for them. And the very little we can, we try our very best to do for them any single day, every single time.
Okay, thank you. I'm going to move over to Jill. And Jill, I'm going to ask you the same question I asked to Gina, our burn survivor, and I'd like you to give us your unique perspective as a burn nurse and a burn survivor on your thoughts about the relationship between burn patients and survivors and their providers. Please go ahead.
Thanks, Rob. Well, being a nurse and also being a survivor, I always call it the Mutual Admiration Club, because the survivors are so grateful for, saving their life, as Gina talked about. But the burn care team is also, they're right along with that journey, trying to keep someone alive and save their life. So I think that there is a special relationship between both. And as a nurse manager and as a chief nursing officer, I think the more the staff can be engaged with the survivors and their lived experience makes them better practitioners and really helps with the engagement. And there is really a special connection between, burn patients are in there a long time. And I'm from the United States, so I can't speak for worldwide, but from what I've heard from survivors across the world is there really is that special connection between those who saved their life and cared for them.
I wonder if you could tell me a little bit about how you transitioned to become a burn nurse after your injury. Tell us a little bit about that.
Well, it was because of the nurses that took care of me. And again, that really just some incredible nurses. And again, I was burned in 1972, so that just the start of burn centers were just occurring in the United States as a specialty. And I was so inspired by the nurses that took care of me. My mom's a nurse, and she didn't really try to encourage me to go into nursing, but it was really the nurses that took care of me that said I told myself if I could help and do 1/10 of what the staff gave to me, I want to do it.
Can you tell us a little bit about your experience in the United States at your burn center with respect to burnout, compassion fatigue, and loss of the workforce?
Yes. Well, I was the chief nursing officer during the pandemic, and just the toll it took on healthcare workers, all disciplines across the United States and the world of the unknown and the fear that I witnessed the burnout continuously every day. And I was very worried how we have to keep people at the bedside. Our burn survivors are depending on having healthy, a healthy workforce that can take care of them. And so, trying, I don't think there's a one thing that fits. I think we have to look at multiple things, keeping them engaged with education. And what I found is the more engaged our staff was with the survivors and their lived experience, the more meaningful their work, the more they feel like they make a difference. And so hearing of course, we had a Phoenix SOAR peer support program at our burn center, but having the survivors come in and not only talk to the patients, but also they help the nursing staff, right? To see this person that almost died to their thriving, as Gina mentioned, getting back in their life, moving on. And that's what we do as burn care providers is we don't want to just save someone. We want to get them to go back and have a meaningful, productive life.
You touch on a point that I think is really important, and I'm going to put in a plug for the Phoenix Society, and that is the importance of SOAR training and the new Journey Forward program, because what you're describing is the importance of teaching our providers how to really connect with the survivors and how it's so mutually beneficial for each group.
Yes, yes.
Um, I wonder if you could tell me about what strategies you use in your burn center to retain your workforce.
Well, helping every staff is different, but helping them find their passion. And for some, it was aftercare, giving them the latitude to, go to events, go to World Burn, help with the support group, as Alberta mentioned, and really, whether it's research, whether, help them find their passion because people that are passionate and really find the work meaningful, it's hard work we do, but it's so rewarding and really, helping them find their passion, keeping them engaged. And as I mentioned earlier, the more involvement they can have with the survivor and their lived experience, the more engaged I would find the staff would be. And they they didn't leave burns during those tough times. And then also recognizing if staff are struggling, we need to pay attention, right? We really need to pay attention and try to help them so they can either, get the help, but and not leave burns. And as a manager, you leave if a 25, 30-year nurse leaves, that's a big deficit in your root, experience level on the burn center.
What are some of those signs that somebody on your team is struggling? What things do you see?
You get to know your staff. So when someone is just angry, frustrated, not being a team player, have very short fuses, I would check in with the staff. What's going on? Like, and I know, well, coming from the United States, I know we're very have a lot of resources, but even talking to them, connecting them with some help And as Gina said, whether you're, on the side of being a burn care provider or you're a burn survivor, just connecting and validating where people are at is very, very helpful and can keep them from leaving the profession.
Okay, one final little question. Again, it's a tough one to answer, but if there was one pearl or piece of advice you could give to the burn nurses in the audience listening today, what would it be?
That the work that they do is so important, and they sometimes have no idea how much they're making a difference with their patients and their survivors that they take care of. And don't ever forget that, because patients will come back and acknowledge the good work that the nurses, the doctors, the whole team. So it really, you really make a difference with patients. And so please never forget that.
Thank you. That's really great advice. I think that'll resonate with a lot of not only nurses, but everybody in the audience who provides burn care. Resonates with me. And I'm semi-retired. Okay, our last panelist that I'd like to now speak with is Eunice. So Eunice, can you tell us a little bit about the burn surgeon workforce in your country and what's going on there and what sort of threats there might be, if any?
Thank you, and good day, everyone. In my country, Nigeria, burn care is under the purview of plastic and reconstructive surgeons. Currently in my country, there are 186 board-certified plastic surgeons to cater for a population of over 210 million people. Now, most of these burn surgeons are within the urban areas of the towns where they live. This number is further threatened by the recent brain drain that is available in the country, that is happening in my country right now. Also, secondly, is the residents. We have the residency training program is what produces plastic surgeons and burn surgeons that take care of these patients. There's few residents too, because of shortage of manpower. So currently, that's what's happening in my country. Thank you.
How are plastic surgeons trained in your country? What's the process?
Yes, the process of training is after our medical school, we do an internship, and then we can continue with compulsory national youth service where we serve the country. We write a primary exam, an entrance exam that will take us to do junior residency program, which lasts for a period of about 36 months. After the junior residency program, the person is qualified to become, to now start specialist training in plastic surgery, which will last for a further 36 months. Yes, so that's the training. After that, the person writes an exam, and once the person passes, the person is authorized to start practicing as a plastic and reconstructive surgeon.
So among plastic surgeons, how many stick with burn care? And second part of that question is, how do you help them stay with burn care? What do you do?
Yes. So in my country, most of us, we take care of burn patients, we take care of other patients that require plastic and reconstructive surgery needs. So apart from burns, we take care of wounds of different sorts, the chronic wounds, the pressure injuries, congenital hand anomalies. In my country, we take care of hand. So hand care is in the purview of the plastic surgeons. And then there's also the aesthetic component. So we do all this lot. How do we keep people to stay in burn care in my country? The reason why we do it because we're obligated to do it. The other thing is that the joy we get when we see our patients come out, when our patients survive, especially those patients that have major burns, the fulfillment from it is what gives us those kickbacks to keep doing our work, because we like and we are happy when we see them survive. So that is what encourages us to stay in. And apart from the fact that it's our job to do. But currently, there's no private practice that is fully into burn care. It's mainly in the purview of the government hospitals.
You mentioned the joy in seeing a patient survive. And again, that I think resonates with every burn care provider when we see somebody doing well. Do you have any stories you could tell us about? I didn't prepare you for that question.
Yes. So I have a lot of patients that have survived. One key patient that I remember a lot was a man that was about 60-year-old that had major bone inhalational injury. Now, his age was something that was not that would have been a down for him, that would have made him not to survive. And the fact that he had major bone inhalational injury. Now we have anesthetists in our place that when patients have are very ill, would need intubation, they provide those services. So as the patient was lucky, the patient was able to get the timely care intubation that he needed. And then as somehow, as fate will have it, in the trauma center where the bone unit was, the gas supply, oxygen supply, something was wrong with it. So the patient had to move to the intensive care unit. So there he got all the care he needed. He was intubated longer than he would have had, like if our patient was solely with us. And then eventually he was able to overcome the inhalational injury he had, and he survived. He made it. So I am very happy with that. We also had another patient recently, 90% TBSA, superficial partial thickness bonds. All hand was on deck, my consultants, the other residents in the team, and she came out alive. So these patients and others that we've had that formerly would not have survived but currently survive are the things that, oh, we are so happy, we celebrate them when we see them. And when we think about it, we want to keep doing more for our patients.
Well, thank you. Actually, all three of you have mentioned the importance of the inter-transdisciplinary burn team. It came up with all three of you, and I think again it's so important to recognize the importance of the team approach and working together and sharing our ideas and strengths to achieve good outcomes. Last question, Eunice. What's the single biggest resource need that you have in your country for burn care?
Finance is the biggest problem in my country. Patients have to pay out of pocket. There's a health insurance, but it doesn't cover for everything. The health insurance, patients just have to pay. It covers, in my institution, for instance, the health insurance will cover medicines. They pay 10% of it. Now, the consumables they need for dressings, the patient have to pay out of pocket. It's not covered by the insurance. So cost, finance is the main problem. We have very few help coming. The only help we get sometimes are when we have philanthropists that are working, sometimes during their birthdays, and other people that come and give, help them. Apart from that, we don't have any aid for them. They have to pay from their pocket. I think the other thing is, because of this cost, patients sometimes present late. So when they come, they already come in infected, anemic. We have to work hard to keep them alive. And then other things is manpower, and then theater space. Manpower would also affect us to even provide the standard of care that patient will have. Early burn, early excision, and skin grafting. Very difficult. Skin grafting, early excision, someone has major burns. We have no skin bank in my country. So all these are problems we have, but despite the challenges we have, we still work hard and we use our basic care and we achieve some successes in our patients. Yeah.
Have you used burn survivors to help advocate for more resources, or what are your thoughts on that idea?
Yes, regarding burn survivors, we started with a WhatsApp group about 4 years ago, where we had them encouraging them, supporting themselves. And recently I met Ami, and Ami has helped us with some resources, and we've moved on from the WhatsApp to virtual meetings, and we've had physical meetings. We are in that process. We know they'll have a role in advocacy, and then they can help to give hope, as the other speakers have said. So we are in that process. We've not used them, but we have that foresight that eventually we are going to use them. And we think that when they come to tell their stories, it will move, and it can also help us get some policies that will improve burn care in my country.
Okay, thank you very much for sharing those thoughts and your stories. I'd like to go back now to Gina Russo, our burn survivor, because we're going to shift the focus a little bit now to burn prevention. And Gina, I wonder if you could tell us a little bit about your thoughts on how prevention efforts might have changed your whole story and your life.
Absolutely. So with the Station nightclub fire, there were so many things that went wrong. Our fire inspectors were negligent in identifying so many things that were wrong in the building. No working fire extinguishers, there were no sprinkler systems, exits were blocked. And also a major problem was crowd management. Had the staff been educated in how to handle a situation in the building, there may not have been as many people injured. I've been working with a fellow fire marshal here in Rhode Island. We've been going around talking about crowd management programs that are vital. It's super important, whether it's a fire, a fight, it doesn't matter. If something happens in a building and that staff is not educated, chaos just breaks out. But if the staff knows how to handle it calmly, as calmly as possible, there's a better outcome. There's absolutely going to be a better outcome.
How did you learn about some of the things you mentioned? You mentioned exits were blocked, sprinkler systems not right, crowd management. How did you learn about all this?
Well, so after I got home from the hospital about 4.5 months later, and when I was well enough, I started to pay attention to the different things that were happening in Rhode Island because of the fire. And I tried to get myself educated on the laws that were in place at the time. And I had family members in the fire industry, so that was helpful for me. It was a passion to want to know what went wrong and why no one did their job properly. And the last 21 years have been spent to make sure that they don't fall back on the laws that did improve. We no longer have what's called a grandfather law in Rhode Island, where these old establishments were exempt from sprinkler systems. Occasionally, there's always someone going to our representatives, state representatives, to try and get that law put back on the books because they don't want to spend the money. And I just remind everybody there was a $176 million lawsuit and 100 people lost their lives. It's not worth whatever you think you're going to save. The crowd management program came to my attention from a gentleman who was working in the state fire marshal's office, and we kind of met by accident. I was going to a speaking engagement and he was as well. When we got to this event, someone introduced us, and he started telling me what he came up with after the fire, and that was the crowd management program that he had initiated. And he's traveled many states, putting that plan into place for a lot of states, and it's helping. It does work. I've seen it work. I also have a home in New Hampshire, and over the summer there was a pretty big fire, and the staff was so educated on crowd management and how to get those people out of that building safely. There was not one injury. And that speaks volumes for what, we learned because of the station fire. There's still some things that we need to work on. That's for sure. The sprinklers are a big issue. People just don't think they're important. And it costs money to install them, but it's worth every dime. It truly is.
Your passion for prevention comes out in your voice. I could hear changes. What drove that passion?
Losing 100 people. One of them was a fiance, and his life was worth so much for his family, for me. And what I have said from the very beginning is I will not allow anybody to forget the 100 who died. So for as long as I'm here, I'm going to continue to talk about what went wrong that night and to remember our 100.
Yeah, such an important message. It really amplifies the importance that burn survivors have in prevention efforts. It comes out so loud and clear.
Thank you.
Well, with that introduction, then I want to move to our next two panelists who are going to give some short presentations on burn prevention efforts that are going on around the world. I'll introduce both of them. I'll introduce Vimal first. So Dr. Vimal Murthy has been a burn and wound surgeon for over 20 years. He's based in the greater Los Angeles area in the United States. Dr. Murthy currently chairs the Global Burn Health Committee of the American Burn Association. He's been very excited to be involved in this webinar, and he's hoping that we're going to be doing this annually, and I hope so too. Our second panelist that we'll hear from is Donald Bliss. He's a retired vice president for field operations at the National Fire Protection Association in the United States. And he's responsible for efforts to promote the adoption and use of fire and electrical safety standards around the world. He's had a 34-year career serving in many different roles, including being a municipal fire chief, an emergency management director, and a fire marshal in the state of New Hampshire. He also currently serves as vice chair of the FEMA National Advisory Council, and he's a distinguished senior fellow with Northeastern University's Global Health Resilience Institute. So welcome to both of you. And I'm going to ask each of you to give us a short presentation on burn prevention efforts. And Vimal, we're going to start with you.
Great. Thank you, Rob. I'm going to share a screen now, and I believe, can y'all see my screen here?
Yeah.
Great. So once again, thank you for allowing me to be involved. So just the idea here is to kind of adopt domestic burn prevention strategies for a global audience. I think we're all hearing about, really the overarching message is how to support one another through this. And for us burn providers, it doesn't really just stop at treatment of burns. I think the passion of Ms. Russo indicates to me that prevention is still something that we have to have a responsibility, stakeholdership in. And I think there are resources out there. I kind of just want to share briefly what those might entail. I don't really have, the only disclosure I have relevant that I'm a member of the Board of Trustees for Children's Burn Foundation in California. It is a non-compensated role that I play. So just in terms of a background here, in terms of WHO and ISBI, the collaboration has identified barriers to how to optimize global burn care. And amongst them, in addition to advocacy, data and measurement, research, capacity, et cetera, certainly I kind of want to focus a little bit on prevention itself. It's fair to say that in urban areas, maybe in sort of a middle to high income worldwide targets, you can be a little bit narrower in your degree of variability. In other words, how to optimize smoke detectors, checking water heater temperature, maybe building codes to minimize problems with electrical wiring. Where it gets a little bit more challenging in sort of lower income rural areas is what amounts to a wider degree of variability. You may have to take into account things like religious or cultural mores. Again, it's probably fair to say that here in the States, we might be fairly siloed in terms of how we do things like food preps and stay warm and whatnot, but we have to be mindful that elsewhere, open wood fires are being used, perhaps kerosene, paraffin stoves, maybe even some traditional garments, including loose-fitting clothing. I am of Indian descent, South Asian Indian descent specifically, so I remember all too much my mom would be making me nervous with her sari near a fire or whatever. But then, you know, other things, cooking pots on ground level. So those things are going to have to be a little bit more thought out because there's going to be a little bit more variability. So again, here in the States, there's the opportunity to partner with domestic burn foundations, or at least, you know, burn foundations. These are well-minded people that share the same passion that we do. Perhaps they are not necessarily, say, boots on the ground in terms of actually engaging patients in terms of the actual day-to-day care, but their role is still very mighty, and dare I say, there are those of us on this call that have very active roles for burn foundations. The goal for here, at least domestically, is how to educate the public to prevent fires and prevent burn injuries. That can take different kinds of prisms, if you will. Support can be emotionally. We heard from our Nigerian colleague about the challenges of getting financial assistance, right? Well, certainly with robust fundraising, potential for financial assistance can be undertaken. We also heard about the potential role of recreational events that can help with morale, help optimize retention. These are things that you potentially can link to with your burn foundations. The treatment aspect can include supporting burn care research, even in things kind of like austere times where you may have disaster components. Your burn foundations may be able to support assistance with coordination of emergency care, maybe help facilitate transfer policies between burn centers. So I think all of us here that are burn practitioners in both the US and Canada have a sense of how we can potentially leverage these, again, well-minded, well-aligned people to help us with our causes. I just kind of wanted to share a little bit of a kind of a specific foundation that I am involved with. Children's Burn Foundation it's based in Southern California. Their website is childburn.org. They do have both a domestic and an international worldwide reach. Not only can we can the foundation sponsor children receive care in the U.S., but as our Nigerian colleague delineated, potentially that funding can also be used to aid local centers to empower them to render the care that instead of having to potentially transport patients stateside, the care can be kept sort of in-house, if you will. And again, there are some robust prevention campaigns. Just wanted to kind of give you an idea of what one is and then how you might kind of repurpose that for your own benefit. Look Out Lucky is a kitchen safety campaign that has been initiated here. It's been already disseminated in both English and Spanish. It tells the story of a cat that has to be mindful of the pitfalls in a kitchen, and the cat's named Lucky, the chameleon's name is Camo. And so with the help of leaders abroad, not only is the message being sort of more co-opted for a broader audience, but translations into Portuguese, for example, for components of Africa that for which Portuguese is a spoken language. We're also working with some of our partners in Nigeria to help with the patois of Nigerian English, which may be a little bit different. So you can kind of see that with a little bit of kind of, reverse engineering a pathway here, these are the kinds of campaigns, these are the kinds of things that we can use to alleviate our distress, right? It's all about how do we perpetuate the caregiver? How do we keep ourselves going? What's our self-sustaining practice? And if you can utilize these various resources, both domestically and abroad, I think it just gives us a little bit more of an opportunity to kind of keep things perpetuated. That's really all I had. I really am thankful for the opportunity to share this. And I do, like Dr. Cartotto was alluding to, hope this gets to be done on a yearly basis. And I thank you for that. I'll stop my screen share.
Thanks, Vimal. That was great. I'm going to turn things over now to our last speaker, Donald Bliss. So please, Don, go ahead.
Thank you very much, and hello, everyone. I am also going to share my screen. So I'd like to start talking about what's known as the National Fire Protection Association's Fire and Life Safety Ecosystem. The NFPA ecosystem identifies the components that really have to work together in order to minimize risk and to help prevent loss, injuries, and deaths from fires, electrical, and other hazards. And it's our belief that having a strong and robust fire and life safety system will indeed reduce burn injuries. So this is a tool that I would encourage you to take a look at as a way to strategize, identify the strengths and weaknesses in your own system, in your own country, and be able to develop some planning and work on strengthening those areas that need assistance. So for example, if the challenge is lack of current fire and life safety codes, that may be an area you want to work on, as opposed to perhaps public education, as was previously mentioned, as being the most important factor in your community. There's a lot more information about this system at the NFPA website, at www.nfpa.org. And I would encourage you to look into that in further detail. And I think you'll find it to be very, very helpful, not only for your own planning, but also for explaining the complexity of the system involved with improving burn safety and burn prevention. Now, you just have to pick up the newspaper or watch the news to see that there are frequent failures in the fire and life safety ecosystem around the world. They happen far too often. The big news events are the large fires that result in multiple deaths and injuries, but we certainly can't overlook the fact that most of the estimated 180,000 burn deaths that occur each year globally occur primarily in the home and primarily in the workplace, and predominantly in low and middle income countries. A friend of mine who worked at the World Bank describes these types of fires that occur regularly in homes and in the workplace as small chronic disasters. And I think that's a really valuable terminology to use, because fires are happening all the time, and they are maybe small in nature. They don't make the headlines like you see here, but they really do need attention. If you had a chronic illness, you need to take care of it. And so we need to really focus on these small chronic disasters that are happening every single day. I've identified here some of the few examples of the global, regional, and in-country initiatives that are underway to prevent burn injuries, to develop and implement better treatment capabilities, and to support burn survivors. Now, I've been watching the chat as we've been going on, and I'm seeing, and it's so rewarding to see how many other initiatives like this are happening throughout the world. But I'm just calling out a few. Those of you that are involved with these organizations already know all about them, but I think it's helpful to understand that there are networks out there. There are models that can be used to build better programs throughout the world. For example, one of the initiatives of WHO is to develop and encourage the use of a burn registry for globally harmonized data. And this will help identify and strengthen information about the scope of the problem of burn injuries. So in my view, we truly have a public health crisis. As was seen earlier in the slides, the types of fires and incidents that occur that cause burns. But unfortunately, most of the burn injuries to women and children happen in domestic kitchens, while men are burned in workplace accidents. There are numerous incidents in informal settlements, and of course, anywhere that large numbers of people gather, whether it be high rises, factories, shopping malls, dance halls, hotels, apartment buildings. And sadly, with the increase in wildfires due to climate change, that's just creating another challenge for us in terms of causing burns. And it's another issue that will have to be addressed with regard to wildfire protection. I've identified a number of strategies here. I know that's going to be discussed tomorrow in the webinar in more detail, but clearly, as has been discussed, there is a need for much more education and awareness on burn prevention. In my own, sorry about that. In my own world of fire safety and fire prevention, I know there's been tremendous emphasis on smoke inhalation as being one of the, since it's one of the leading causes of fire deaths, and almost neglect on the behalf of fire safety professionals on the importance of burn prevention. I think that's something that needs to be corrected. Product safety oversight needs improvement, particularly when you look at things like lithium-ion battery fires that are on the increase. Lithium-ion battery fires happen to be the primary cause of fire deaths in New York City right at the moment, and they're increasing worldwide. Regulation of building construction and hazard reduction in buildings is critical, and paramount to all of this is the collaboration of healthcare providers, educators, faith-based organizations, and other NGOs, as well as government. And I would also second the importance of having programs like this on an annual basis to increase that type of collaboration, but thinking about as well the non-traditional organizations that may not currently be involved with burn prevention and burn strategies. So, for example, if you have a healthcare organization going into a community doing medical intervention or doing vaccinations, well, why not train those folks on burn prevention as well? So they're there, they could look at cooking practices, the lack of smoke detectors and other issues. So that type of collaboration with the non-traditional burn safety organizations, I think would be really, really helpful. So with that, I thank you for your attention, and I will return you back to your moderator. Thank you.
Okay, thank you very much, Don. We're just slightly over time, but I do want to have our final guest come on for some closing comments. I'd like to introduce Amy Acton. She's the CEO of the Phoenix Society for Burn Survivors. She's a burn nurse and burn survivor. Amy, go ahead.
Well, thanks. And I'll keep my comments brief. I've prepared to shorten because I knew we had a lot of great perspective to add. And I think my only comment is there is a lot in common of the challenges that we all face, whether we're a healthcare provider or a survivor or in the fire service. So I think for me, the World Burns Week is such an opportunity of the commonalities and sharing the stories of the burn cause. And by coming together, we'll lift up all boats. And I think that's what's so exciting about this event is that we're all doing great work in our, we'll say, silos. And as a burn survivor, I will say you have no better champion than the burn survivor community. And I think that's where if we can fully engage the survivor community, along with the healthcare providers, along with the fire service and industry, we have a powerful voice and we can lift up care throughout the world because there is a deep disparity in this world for care of burn survivors and the acceptance and inclusion of those of us living with burn injuries throughout the world. So I'll just end with that. This is a great first step. I believe that we will continue to grow and collaborate together. And I want to thank everybody for their comments today, and be sure to join us tomorrow and Friday as we close out the week and make commitments for the future.
That's great. Thanks, Amy. So I'd like to thank all of our panelists and you, the audience, for joining us. And as Amy said, remember, this continues next week. Same link, same time. Goodbye, everybody.